I was the girl that if a colonoscopy was full of poop, I would be out of there because I would say, not clean prep, redo the prep tomorrow, stay on clear liquids. My colleagues would wash and clean, and I would be, nope, not washing, not touching poop. But now, God has a sense of humor because here I am literally collecting. And somebody asked me the other day, they said, do you actually collect your own stools and process? I go, yes, I do.
Hello, I'm Robin Jeep with Enliven Foods. This is World Changers podcast, which introduces you to brilliant innovators who crack codes and provide solutions for human health. Recently, I sat down with Sabine Hazan, a gastroenterologist and the foremost microbiome researcher. I was so honored to be able to interview Dr. Hazan. So get ready to learn about the magnificent universe within. She's one of the few microbiome researchers that's really getting into the, I'm not going to say it, into the trenches, studying the microbiome. And she's learning about really what makes us tick, because it does seem to be that that's what makes us tick. All those little sentient beings that live inside of us, and hopefully we work together synergistically, but sometimes things go on and we don't work together synergistically, especially if people haven't really taken care of themselves. And in our world, there are a lot of toxins and a lot of things that affect our poor little helpers inside of us. And so with that, so thank you so much, Dr. Hazan, for being here.
My pleasure. Thank you
Your
for having me.
message. You're welcome. Your message is so important. It really is so important. That's why I want to share this. And I want to just go into some of your background and experience. And so, like, how long have you been practicing as a gastroenterologist?
About 3 decades, 30 years. A little bit more than 30 years, yeah.
So you've looked at a lot of
myself.
You what?
I'm going to age myself, but yes, a long time.
So you've looked at a lot of digestive tracts.
Yes, I started off with colonoscopy, gastroscopy, capsule endoscopy when that came around about 20 plus years ago. And I've done a lot of clinical trials for pharmaceutical companies. I've brought a lot of products to market, did a lot of clinical trials for products that didn't necessarily go to market. And about 7, 8 years ago, I started on this microbiome space of analyzing feces. Something I could tell you was definitely not me. I was the girl that if a colonoscopy was full of poop, I would be out of there because I would say, not clean prep, redo the prep tomorrow, stay on clear liquids. My colleagues would wash and clean, and I would be, nope, not washing, not touching poop. But now, God has a sense of humor because here I am literally collecting. And somebody asked me the other day, they said, do you actually collect your own stools and process? I go, yes, I do. So it's been an interesting field. Mostly because I've also discovered that there is such a thing as a resilience that you attain playing with poop, playing with the microbiome, and there's a way to stay in balance. Really, that's been my interest, to be the guinea pig on the front line and to say, how do I survive COVID, right? How do I expose myself to all these patients and survive COVID? And am I right? And is it all about, the microbiome? And I think I'm right, but we'll see.
So is it, if the person, if they didn't do a proper prep and there's a lot of poop in there, so is that a risk to the doctor when that happens?
You mean a risk? No, it's just that we would miss when we do colonoscopies and there's a lot of poor prep in there, you would
Yes.
miss polyps.
Oh, I see. Okay, so
Patient mostly. So I did not want to play with it and wash it because then there's a risk of it. It's better to just keep the patients on clear liquids for 24 hours and tell them to come back the next day. So you have a better prep so you don't miss anything. The whole purpose of colonoscopy is not to miss anything.
Yeah. These are things that, you know, we, the lay people we don't know all of
Yeah, yeah.
this. Very
And realistically, like if you don't have, I would tell my patients, you have to have clear stuff coming out of your colon. If right before the colonoscopy, if you don't have clear stuff and you still have poop in there, you're doing the doctor, uh, you're not helping the doctor help you, right? Ultimately, it's to help you that they're doing a colonoscopy, especially these days.
Yeah, it would be helpful if we got more, if I think if patients were given a little more information about things like that, but we're going to get into that in a little while. Well, one of the things I want to know is, have you observed an increase in GI health issues, you know, over your career and especially since 2021?
Well, I think the most, the thing we've seen as an increase recently is colon cancer in the young. And that's not necessarily obviously since 2021, we've seen it a lot, but we've also seen it, I remember, when I started GI, the average person that had colon cancer was an older person. Now it's a younger person. So it's hard, it's interesting to see the young having colon cancer. And as young as like 22 years old, that's not something we would see typically. So if a young person has rectal bleed, change in bowel movement, back in the days, we would probably be saying, oh, irritable bowel syndrome, don't worry about it. But now, with everything we're seeing, I would say get a colonoscopy, consult a GI doctor, because there could be something there. The big mistakes that primary care doctors do is to ignore a young person with rectal bleed and assume that it's just hemorrhoids. You really have to do a colonoscopy if the person is having rectal bleed. So if anything that people are listening to this today, change in bowel movement, rectal bleed warrants a colonoscopy.
Why do you think we're seeing more of this in young people?
Well, I mean, you can go I don't want to say conspiracy, because these days everything is a conspiracy, right? But if you go the route of, if you look at the foods that we eat, first of all, foods are full of pesticides. An orange is not the same orange that we used to eat as kids. It tasted, I just came back from Portugal and I had an orange over there and it tasted like an orange from my childhood.
Yes.
Here, it doesn't taste like anything. Like a strawberry, you have these big strawberries at the grocery store, and it doesn't taste like a strawberry. And then you grow them in your backyard, and it tastes like a strawberry. You grow an artichoke in your backyard. You don't spray nothing. It tastes like an artichoke. So I think we overdo it. We kill the soil, which is essentially where the nutrients are that allow the fruit to grow, right?
Yeah.
So we kill the soil, the soil lacks, we kill off all the fertilizers, whatever would be fertilizer, and we end up having, bad soil, which gives you bad fruits.
Yes.
And now we expect that fruit to help us with our vitamin C level, and to help us with our vitamin D, etc. It's not happening, and then vice versa. You look at the salmon and, your fish, where you're getting your vitamin D from. And even those have been affected. I saw, there's so much that we're doing that should not be done, that somebody has convinced someone else that we should do it. And I remember speaking to a physician on one of the spaces on X, and she kept saying, well, let's not throw the baby out of the bathwater, whatever that means. And she kept talking about like how pesticides was the best thing that ever happened to the agriculture. And I have to say, yeah, it may be the best thing as far as production of food, but it's the worst thing for humanity that's ingesting these products that are essentially full of poison. I mean, and I'm going to say it out there, poison, because when you see a pesticide that has a skeleton and it says, do not drink this because it's a poison,
Right.
and you're putting it on my soil and on my vegetables and on my blueberries, my strawberries, my raspberries. And this is not like small amounts of sprinkles that they put. It's gallons. I mean, you go through a field and you see they have automatic machines now that go through the field and just spray the hell out of all those vegetables. It's disgusting. So you're
It is.
eating a blueberry full of pesticides. Well, you might as well, have it as your new sauce, you know?
And it's poisoning the microbiome, right?
Uh, yeah, yeah. I mean, listen, when you see these cases of Parkinson's and, have you been exposed to pesticides and do you have Parkinson's? Have you been exposed to pesticides and do you have lymphoma? I mean, there's legal cases out there that are showcasing this problem that we have, which is stop using the Roundup because you're at risk of having lymphoma. In my own family, my husband's father used to spray it like crazy and he ended up dying of a lymphoma. So there's something to that. And then, when you look back, and you hear the story of someone spraying the grass and then the kid ends up having lymphoma later, you ask yourself, did the father spray the grass and did the kid play on the grass after the dad,
Right.
sprayed? And did
Running
the
around barefooted.
Yeah, and walking barefooting, and therefore that pesticide went into his body, killed his
Yeah.
microbiome, therefore there's gonna be a time where we're gonna start realizing that all these cancers are microbes.
Well, I think that a lot of people do realize it, but it's a financial situation. Yet there are people that are making a lot of money making these pesticides. And what do they want to give up
They
their
brainwash
wealth?
the world, because it's production, right? They want to produce the fruits and the vegetables, and we have to feed the planet. So how do we feed the planet while, so it's a business model. It's a great business model, I'll tell you that much.
Yes, it
But
is. And I to be honest with you, and I don't know the answer. I mean, I've read some stuff, but I don't know. Can regenerative agriculture actually feed the planet? Can we feed the planet with that? Or have we upset the ecosystem so much that the pests are so bad that now if we tried to do regenerative farming all over, that it might, I don't know.
problem, we're overfeeding the planet, if you ask me.
Well, yes, clearly.
We don't need, one of my least favorite stores is Costco because everything is in mass consumption, right? You
Yes.
have
Yeah.
big cream cheese, right? And
Right.
I always joke and say, you end up wearing the cream cheese, right? Because you see it in your fridge, you're tempted to buy it. So you end up buying, you see it in your fridge and you go, I'm gonna have a little bite, and I'm gonna have more and more. And then pretty soon in 1 week, you finish the whole big container of cream cheese. You end up wearing that. So I think mass consumption is the problem. Here's what happens as to us, physiologically, when we start eating mass consumption. You stretch out your stomach. So the stomach is the size of a fist. So you're supposed to eat the amount of proteins, that's my fist, and then the amount of vegetables, my fingers, right? That's it. Majority of people are stretching out that, right? They're stretching it a little bit more. So what happens is you've got a satiety center that basically tells you, "Ooh, I'm full." So pretty much you're stretching that satiety center, right? Little by little. Eventually your stomach becomes this big balloon and you don't have the ability to stop yourself from feeling full, right? And
Right.
when you don't feel full, you keep eating and consuming. We
Yes.
need to shrink up that stomach again to basically, that's why intermittent fasting to me is a great diet for those people,
Yes.
because it allows that shrinking of the stomach. to get back your satiety center, if you can get it back, right? Because essentially, it may have been damaged in the process of stretching out. So with that, you're stretching out, you're over consuming, you're killing your gut, because now you're putting all sorts of foods in there that, are not necessarily good for you. So now your balance of your microbiome is off because you've got too much pressure in one area of the bowels versus another. And then eventually what happens is you start going into this rapid decline of chronic, you're going into a domino effect of chronic disease, right? So essentially I'm stretched out my stomach, that food goes into my colon, affects the colonic balance, and now I'm not metabolizing sugar as well, I'm not metabolizing calcium as well. So now my mitochondria are not getting sugar or calcium. Well, how is metabolism going to occur when you're lacking sugar and calcium, right? If
Right.
you know anything about the Krebs cycle, which is what we learned in vet school, that's how your metabolism occurs, right? But in the Krebs cycle, you need your sugar, you need your calcium. So how does that happen? How do you metabolize? How do you absorb sugar? How do you absorb calcium when it doesn't go in the cell, when it doesn't get broken down, right? So
No.
that's the problem. So it starts with what we're feeding our guts, and it starts with the quantities we feed it. So nobody needs to buy, a big cream cheese. You can buy a smaller amount, and I would encourage, the businessmen to sell a better quality of a cream cheese at a higher price.
Yep. For smaller amount.
How much money would people are spending on diets, on losing weight, on the right foods, right? So if you have the right food and you discipline yourself to lose weight, to do intermittent fasting. Look, I gained a lot of weight during the pandemic, okay, because I was taking care of patients, and I started getting, increasing my weight. And of course, I'm at a certain age where I'm not as young as I used to be, that I
Right.
can't eat as much as I used to as I used to eat. But here's the thing, at some point, you got to look at yourself in the mirror and say, you know what? I'm not happy. I've gained weight. I need to lose it. You need to have discipline. So in other words, I'm going to skip that big lunch. Or if I'm eating a big meal, I'm going to say, you know what? Today I'm not going to deprive myself of that meal that is
Yep.
really tempting. But then the next day I'm going to say, because I overdid it on that meal yesterday, I'm going to restrain myself today. And you keep yourself in this balance, right? Because at the end of the day, it's calories in, calories out. You want to lose weight, you got to lessen your calories and increase your output. You
I have
know,
a question about this. A lot of the people that will be watching this are like whole food plant-based eaters.
yes.
And, I've been counseling people on whole food plant-based eating for over 20 years now. And one of the things, and I want to ask you, this is what I need to know about this. When a person's transitioning from the standard American diet, and they're addicted to all that garbage, and they're filled with toxins and stuff, and so they're going to go through detoxification and withdrawal and all that stuff. What I've always taught people is to go ahead and eat as much as you want of the plant-based foods, of the whole food plant-based foods, especially the cooked vegetable, because they're easier to digest for you as you're transitioning. And to stay full, because I find that helps them deal with all of their addictions, and if they just stay full, they're not as apt to go back to the other stuff. But
So yeah,
I,
that's not something I would
but
recommend.
that's what I was going to ask you is when people, even though they're eating the super healthy food, nothing's wrong, the food's excellent what they're eating. What is it doing to their guts when they're overeating all of this healthy, fiber-rich food?
Well, I mean, it's hard to tell without testing it. It'd be
Yes.
nice to test it. But my concern is, are you stretching your satiety center? Are you are you deregulating your pressure in your stomach with your pressure in your
Well,
small
they
bowel?
would be. I would think they would be.
You would.
Yeah.
So, I mean, the bowels is a very simple organ. It's essentially starts in the mouth and finishes
Yes.
in the anal canal. It's a big long tube, right? So it's like a hose. At any point, you've got a pressure point, or you stretch out that hose, it's going
Yes.
to affect the rest of the hose, right?
Right.
So
Right. Yeah.
physiologically, I would think that's not a good thing. Okay.
Well, do you think, I mean,
Here's
because
the other thing.
it's an issue to help people get, I'm dealing with a woman right now that was 280 pounds. And she has all kinds of GI issues, but I deal with a lot of these people. It's worked with some, and I tell them, okay, in the beginning, we're going to fine tune this later, intermittent fasting, all this stuff. But right now, I want to get you past this initial time where you're going through a lot of the physiological withdrawal, the detoxification and stuff, where you have the gnawing stomach and those things that come when people start losing weight. I want to get you through that. And so during this time, you can go ahead and eat as much of this good food as you can. You're not going to do that forever, but as much as you need to, and as often as you need to eat it while we go through this period till you're feeling better. So, you've done a lot of it because that detoxification makes them feel so sick. And then I fine tune it. I start fine tuning it with them. And I've wondered about that because I've been doing that for years. And I just wonder if I'm damaging people's guts by doing that for 6 weeks or
Try
so.
to see how they're doing. I mean, if your patient is losing weight but then developing arthritis, then I'm guessing you're probably not doing well.
Okay.
If your patient is losing weight but then gets a cancer, you're probably not doing well because something happened that changed that microbiome that got us to, where that patient is right now. So it all depends on the clinical, I would imagine.
Okay.
Here's the thing, what I've realized about the microbiome is everybody is different. And everybody is different in their absorption, in what they can absorb and what they can.
Yes. Right.
I will tell you, if you give me fava beans, I will be putting a heating pad on my belly all night because I don't tolerate fava beans. They're
Mm-hmm.
just not my food. Now, why is that? Maybe I'm missing microbes that help decompose that fava bean, right? But yet another person, they thrive on that and it actually helps them, like I have some Parkinson's patients that are telling me that they eat fava beans and it improves their symptoms, their tremors, it improves them. Not saying it's a treatment, but symptomatology wise, right?
Interesting.
So again, the Parkinson's microbiome is different than my microbiome, right? And so therefore, that food is not for me, but could be for a person with Parkinson's. So I think, when we look at the microbiome, it's important to see what microbes are present there and what microbes are missing. I think the idea of a one pill fits all is wrong. I think the idea of, you know, a one cause to a problem is wrong. I think there's multifactorial causes, yes, the pesticide is one thing, probably antibiotics, probably stress, probably the media, probably the music. There's so many factors that, in my opinion, play a
Interesting.
role in the creation of disease. And then we have mental status, right? Is a person, does a person who, you know, lose a spouse, does that kill your gut? And
Right.
so you're starting your own, domino effect towards disease. Yeah, so again, if we think, well, just the pesticides alone, there's a lot of people that are exposed to pesticides and are fine. Why are those people fine? And yet the guy who sprays his backyard gets lymphoma, right? So, there's so many microbes too. And I tend to think it's, it's, it's a domino effect, but it's also the perfect storm. It's you sprayed with pesticides, you got stress from your job, you got, you ate some food that was really, full of bad microbes, And that perfect storm occurs and bam, cancer starts, right? So, and it's really kind of coincidental in a way, but at the same time, if you didn't eat that meal, probably you would have avoided, if we believe that microbes in food can play a role towards our developing of cancer, right? And vice versa, the person, of like certain microbes that are transmitted from patients to patients, right? Is that microbe, was I at the wrong place? Let's talk about COVID, you know,
Let's
was
talk about
I at the wrong place? Here I am exposed to someone with COVID, didn't get COVID, but yet here I am stressed, having been on an airplane, exposed to multiple people that were coughing, coming to work stressed, not sleeping. Now I'm exposed to the COVID patient. It's that perfect storm where you needed all these things to happen for you to catch COVID. So I think that's how we have to start looking at disease. We have to start looking at, unfortunately, you did all these things that basically bam, the last.
Well, they'll have to change the medical school, medical training to do this.
Well, yeah, they'd have to like start thinking that you have to do a differential diagnosis. You have to look at the whole human being, the whole
Right.
thing. We tend to think, and honestly, that's part of the problem in medicine right now, is we're so specialized.
Oh, yeah.
GI, you go to a gastroenterologist, you don't talk to the GI doctor about your headaches. You don't talk to them about your sinus problem.
They don't want to hear about it.
Well, because that's not their field. Oh, see the ENT. But here's the thing, it's not their fault, okay? I mean, we tend to blame the physician, but who's to blame? The insurance company is paying the doctor for 10-minute visit, right? And the patient does not want to invest for that extra 20 minutes with the doctor, where the doctor is charging cash because the insurance company doesn't pay. And here's the other thing, that we have to retransform our brains to say, the government is not going to be our doctor. Our insurance company is not going to be our doctor. They're not going to be there as we're suffering. We need to help ourselves, okay? How do we help ourselves? We start investing in ourselves. We start investing in our research. When I started Progenabiome, my genetic sequencing lab,
Well, let's tell about, before you go into Progenabiome, let's tell about Progenabiome. Can you tell us?
Progenabiome is a genetic research sequencing lab. It's a genetic research sequencing lab where we're basically trying to understand the microbiome of humanity. We're trying to preserve the microbiome of humanity by regions, and we're exploring the microbiome in various diseases. So in other words, what does Parkinson's look like in the microbiome? What does Alzheimer's look like? What does autism look like? And then we're trying to manipulate the microbiome to restore it back to the way it was, knowing that we don't know what it looked like before. So it's the wild, wild west. It's a genetic lab that I honestly didn't, when I started it, I didn't even know what genetic sequencing was. I had no clue, because we don't learn that in medical school. And I was way before my time too. I mean, I'm from 30 years ago, I went to med school, right? So we didn't have the technology that we have now to analyze the microbiome. I mean, it's spectacular what we can do with one specimen of stool that's the size of a fingernail, that you could see this vast world of microbes with one fingernail of poop. It's unbelievable. So, I went into it basically to understand disease,
Mark.
to understand, the differences between my kids in their microbiome, in their health, in my health, in my husband's health, in my parents, in my sisters, my brothers. So it was really because I can't, and believe me, nobody wants to spend millions of dollars on research. But I felt that if I didn't do it, who's gonna be helping me when I'm at the age of having,
Right.
cancer or Alzheimer's or, Parkinson's? Who's gonna help me with that? And so to me, it was important to invest in that.
So that's why you got started with that. So you have your
And it was literally, it was kind of on a whim. It was, what if I'm that person that develops Alzheimer's in 20 years from now? And I'm not gonna remember my daughter's name or my grandchildren or anything. And I'm gonna go back, I'm gonna look back on my bed and say, I coulda, shoulda, woulda opened that lab, and I didn't. So sometimes in life, you go above and beyond to basically to see what nobody sees, because it's going to help you. You have that gut feeling, and it did. It helped me with COVID. I mean, I survived COVID. I found COVID in the stools. I discovered bifidobacteria. I discovered so many things that helped me.
Well, so I want to ask you about labs. So there are quite a few labs out now, as you well know, that are doing the stool analysis. And
Yes.
what is the difference between your lab and those labs?
Well, for one thing, we have clinical data.
Okay.
So we understand at best that we can, what a normal microbiome looks like. And part of the reason that we understand that is because I'm a gastroenterologist and I do fecal transplant.
Mhm.
So doing fecal transplant, you can go back and kind of see what's changed in the microbiome when you improve a disease. So for example, I improve a patient with Alzheimer's by fecal transplant, I can go back. That doesn't mean everybody can be improved with fecal transplant for Alzheimer's, but for that one patient, I was able to see what happened with fecal transplant, right? So I think I have a better understanding, mainly because of that. Secondly, our assay is valid, verified, and reproducible. In other words, I can reproduce my data today, tomorrow, next year. It's still Sabine Hazan. The other thing is, because we practice the art of I practice the art of medicine. I
Yes.
stepped in COVID. I had the courage to treat patients with ivermectin, to treat patients with hydroxychloroquine. So I saw what those drugs did to the microbiome. So when you see that, you basically get a better understanding. You see a patient is dying, and then you see you've improved them. So I always say, to understand the microbiome, you have to reach a cure. To reach a cure, you have to practice the art of medicine and be courageous on the front line, and have the intuition of what to give that patient, right? So because I come from a training of having done so many clinical trials in my life, I have knowledge that nobody really knows, right? Because I've done clinical trials on biologics. I've done clinical trials on cholesterol medications, on PPIs, proton pump inhibitors, creams, steroids, etc. So I have a knowledge of how those drugs are made, how the whole concept of how to bring a product to market. Something, and I also know what drugs worked, but never made it to market, and what drugs didn't work and made it to market, right? So I have a knowledge that most people don't have.
You
That
do.
knowledge helps me with the microbiome. It's been an education. Having done clinical trials for pharma was probably the best education. It was probably better than medical school, because I was privileged to have done, over, 300 clinical trials. I
Wow.
learned a lot. I read those protocols. I lived the experience of what these protocols are doing to patients. So when my data gets retracted on research, or people are questioning my research, I just have to say, well, why didn't you question it when I brought drugs to market? Then should we
Right.
question
Well,
those
so
drugs that I brought in?
I want to give some backstory on that, just what you're talking about. But before I do, I want to go into a little bit into COVID.
Yes.
So with the COVID, didn't you kind of come up with a lot of these protocols that then started being used with the ivermectin, the different antibiotics,
So
the
Dr.
vitamin
Tom
C,
Barodi, yeah, so I was privileged before COVID to have partnered with Dr. Tom Barodi, who
yes,
I wrote the book Let's Talk Shit with.
yeah.
Um, yes, and so yes, we wrote that book together. I was privileged to work with him because he also was the doctor who was innovating drugs for
And he
pharma.
was from Australia,
It's
correct?
from Australia.
Okay.
And he was doing a lot of fecal transplants.
Right.
And he actually started, so fecal transplant goes back to the 4th century China, where they used to give the yellow soup and it was feces to patients with diarrhea.
Would they
And
eat? Would they eat
it
it?
would give it to them by mouth to swallow. So it
That
was
must have been
literally,
fun.
yeah. So back then they didn't know any better, but they had the intuition that if they gave this, the patient would improve. And sure enough, the patients did improve. So fast forward to 1980s, 1980s, no, 1950s. There's a doctor that basically started doing fecal transplant on 2 patients with C. diff. C. diff being a bacteria we get from taking too many antibiotics. And from there in the 80s, Dr. Barodi started doing it for C. diff, but also multiple other diseases.
And it can be life-threatening, C. diff, right?
C. diff can be life-threatening. People have died from diarrhea.
Right.
Myself, I was the girl that was doing clinical trials for pharma for C. diff. I was bringing antibiotics to market or monoclonal antibody. I did the monoclonal antibody for Merck. So
Oh,
we
wow.
brought that to market. When when C. diff didn't succeed on those clinical trials, I did fecal transplant on those patients. And the first patient that was a physician that I did that was dying, and it worked, it really blew my mind because my friend Neil Stolman would show me the data. I read the data from Dr. Barodi, but until you start doing it yourself, you read it, but you don't really see it, right? Until you start. And I always remember that first case because I called Dr. Stolman, who's basically was my fellow when I was a resident in Miami, at University of Miami, Jackson Memorial Hospital. And he would always say, the future is in shit. And I would say, Neil, don't make me play with it. I'm in the clinical trial world, etc. He and I, joined forces on this because, and it was kind of funny because he would be at the big national meetings at GI and he would be speaking in front of like hundreds of people or 1,000. And he would say, well, Dr. Hazen, my friend, doesn't believe in fecal transplant, but here's the data. Because I was the girl that was doing clinical trial for pharma. So for me, it was easier, cleaner to put a patient through clinical trial with a pharma drug, right? And somehow, when the pharma drugs didn't work, I would do fecal transplant. And when I saw that it started working, it kind of brought me, I was still doing my clinical trials because that was cleaner. But I'll always remember we met at a meeting where he was presenting on the data on using fecal transplant. And I was given a drug of fecal material to do a clinical trial on. And I said, and here we are, clinical trials,
A drug of, I mean, like those
a
pills?
pill poop, yes.
Okay. Yeah, okay.
And so that's when we kind of joined up because essentially I was doing fecal transplant for my patients and the clinical trial didn't work. But when clinical trial became fecal material in a capsule, I said, here we are, all those years that he was trying to convince me, here we are. It's part of the pharma clinical trials now, right? And that's when I went rogue because I said, we're selling feces and we have no idea what feces do. And I started looking at my own data of patients with fecal transplants, started looking at, cases of arthritis that improved, cases of, Alzheimer, one case of Alzheimer that improved, etc. And then essentially from there, it kind of opened the world of fecal transplant and the microbiome, and I think the PR and the marketing took it to the next level, because it's always people get, they get this buzz and they want to make a business out of it, right? So we were still here not talking as GI doctors. Think about Let's Talk Shit came out to the public from me as a GI doctor, but who was talking about that before that? No one. No, it was really hush hush. Even within the GI community, they didn't want to talk about it. They didn't want to, you know, make people aware, because we were, rightfully so, we were thinking, oh my God, if we start speaking about it, then somebody's going to basically, somebody's going to start doing it at home. And now we're going to cause more harm than good. Because imagine a person doing it at home without testing their microbiome. Or even knowing if they have a bacteria, if they're taking on a bacteria from a microbe, that's a bad microbe. So that's the story.
Well, so what do you think about, you've got these clinics in Mexico where people can go down and get fecal transplants. I mean, I want your opinion on all these things, because people are doing this and they're desperate. They're desperate.
Out of desperation, yes.
What do you think about those people going down to those clinics in Mexico for fecal transplants?
I think look, I'm not going to say it's a big mistake. I mean, your body, your choice. I'm always a big advocate of freedom of choice.
What are the cautions?
Well, precautions is you don't know who you're getting, right? You don't know who the donor is. So what if and by the way, the same thing that grows hair, we saw the cases of Dr. Colleen Kelly of, patients growing hair from fecal transplant, but the same side, there's people losing hair from fecal transplant. I have a celebrity right now who did it out of desperation, didn't test the donor, and now she has complete loss of hair.
And once you get it in you and it's colonized, you're stuck with it, kind of, aren't you? I mean,
stuck with whatever that microbiome is, and does it match you? Is it meant to be you? Remember, you're trying to reproduce what you were.
Right.
So, and you don't even know what you were. So, that's a problem.
Well, what you told me that, because, we had talked about it in the beginning, you were thinking more about it from me, but then later, because you know how sensitive I am and how I react to everything, the last thing you said, I would not do a fecal transplant with you, because who knows what your body would do with that. And so there are people like that don't even know that, that they could react horribly to this.
Oh, absolutely. I mean, you're introducing microbes that your body never saw. Your body never was Remember, immunity starts in the gut because it recognizes microbes.
Right.
That are good, and therefore you're immune to them. But if you're recognizing a foreign microbe, you're going to reject it. The body rejects the unnatural, and the body rejects things that you never exposed it. So fava beans, I've never exposed my body to that. It's going to reject it. It's going to put me in a horrible situation where I'm putting a heat pad on my belly. So, we have to be cautious in realizing that we come from parents and grandparents who have had a life, who have been in different regions, different locations around the world, and they've accumulated microbes, right? Same way that as Sabine Hazan, who was born in Morocco, went to Montreal, went to,
I'm surprised you didn't eat fava beans.
Well, guess what? Maybe I lost the microbes that was, on my way from Morocco to Canada, where I probably got sterilized like crazy with all sorts of, alcohol swabs and antibiotics. I got a ton of antibiotics as a kid. It was, when you were, and then, back in Morocco, they used to give rectal suppositories of Tylenol, so who knows what that does to the microbiome, right? So I think ultimately, you know, we all have a different signature microbiome and we all have accumulated different foods. When I went to China and I started eating the local foods over there, my body didn't tolerate it. Why? Because I'm not from there. That's different microbiome than Morocco,
Right,
right?
right, right.
And even Morocco, let me tell you, I went back to Morocco to the desert and I got extremely sick with E. coli from the desert. Now, you would think, being from Morocco, I probably had that microbe in me and therefore would be resilient to it, right? But no, somewhere along the line of going to Montreal and Florida and California, I must have lost it. And so when I go back to Morocco, now my body doesn't tolerate that microbe. I drank water from the well in the desert with ice cubes that were, I was very careful not to drink the water, but then I needed ice cubes in my drink, and sure enough, that was the water. So, there are so many ways that we've lost so many microbes. And so what you have, we tend to think that it's all microbes too, but there's also the colonic mucosa. The microbes are sitting on colonic mucosa, so if you don't have that receptor that's, accepting that microbe or doesn't recognize it, that's a problem.
But something I've wondered about, as I wonder if you have, is that people have started, I don't know, in the past 15 years maybe, they started, eating all these superfoods and all these exotic things that nobody's ever eaten in the United States. And everybody starts eating all of this stuff and their bodies are not used to it. And I sometimes wonder, just even like
Well,
chia seed,
I'll give you the
you
best
think,
example.
yes,
Sushi became really popular
I
about
knew
20,
not to eat
30
that.
years.
I knew
Think about
intuitively.
it. Sushi became very popular 20, 30 years
Yes,
ago. Sushi has a lot of, it's raw fish. It has a
yes,
lot of parasites in it.
yes.
Okay. So every time you're eating that, are you getting parasites? Everybody's talking about parasites and parasite cleanse. Well, stop eating the raw
Right.
fish that's
You
giving you those
you
parasites.
see, as a chef, being a chef, I've dealt with fish a lot in
You,
my pie.
you
I
see
see the parasites in there. I see the worms in there. Little
that,
white
yeah,
thread like worms.
yes. And so, what does that do, to the microbiome? What does that do to the human being? Where does it land? Does it land in your pancreas and start creating a cyst in the pancreas? You know, and then same thing, does it go to the brain? Does it, start creating a cyst in the brain? So, but here's the problem. As I say this right now, somebody's gonna listen to this and go, oh my God, I eat a lot of sushi, I gotta cleanse.
Right.
No, if you're healthy, do nothing. Do nothing if you're healthy. Because we tend to listen to all these podcasts and
Oh,
then
I
yes,
know.
panic and fearful. And then we overdo. And then in the overdoing, we're killing our microbiome. Because let me tell you, the parasite cleanse that you're gonna do is gonna kill the parasite, but also your microbiome.
Well, and also, but one of the things I tell people, which I do understand about parasites, is certain things you take for parasites, this herb or vinbendazole or ivermectin or whatever, it takes care of these parasites, but it doesn't take care of these parasites. And so you have to, if you're,
But again, it kills your microbiome.
well,
You
yeah, but you
talk
should at
about
least
benzosol.
know, don't just take a parasite clean. If you think you have parasites, there's a place in Arizona I know about, and you've got a parasite test. Find out if what parasite
That's
you have.
exactly what I would say. I would say first find out if you have it, okay?
Absolutely.
And there's so many places that do a really good job at parasitology, okay?
Yes.
So find out first if you have a parasite, okay? But here's the other thing. If you have no symptoms, leave it alone.
Leave it alone.
I have a patient that called me who I've been treating to improve the bifidobacteria. And she called me and she says to me, I have chronic urinary tract infections. I said, how do you, I have a UTI. I go, what symptoms do you have? Oh, I have no symptoms. Well, how do you know you have a UTI? Well, I tested myself. Okay, where did you
With
get the test? From the pharmacy. How old is the test? Is the test expired? Is it, and what did it show? It showed mild leukocytes, okay, mild white blood cell. But here's the thing. If the test was sitting on the counter of the pharmacy for about a year,
yes.
it's gonna be messed up and it's gonna tell you have mild leukocytes. So I basically told her, I said, don't worry about it. You have no symptoms. Leave it alone. Why are
Leave
you
it alone.
testing if you have no symptoms?
Yeah, why all
That
these tests that people can go get for all these things that I mean, I,
no
I agree.
symptoms, leave it alone. If you're healthy, if you're focused, if you're exercising, if you're eating right and you're doing everything right, leave it alone. Why are you scratch? You know, there's an expression, the more you scratch, the more you scratch, the more you hit blood. You know,
Well,
at some point you gotta stop scratching, you know, the more you look, the more you're gonna find.
but isn't this true that even certain parasites work synergistically with us? They help
Absolutely.
us in certain ways. So if you have no symptoms, leave it alone. You may have some parasites, but it's working now. You know, that's well, I want to get into I do want to go, you know, because the COVID's going
And
to take us to the bit.
use certain things that are common sense, right? Like,
Yes.
you know, the reason for soy sauce, you know, to dip the sushi probably kills the parasites. Lemon water is great, you know, lemon juice is great as an antiparasitic, you know, as well.
Is it vinegar as
You know,
well? Yes.
vinegar, you know, alcohol, you know, so, you know, I'm very, when I, you know, cause I do eat sushi, but I will make sure I have my ginger. I have my lemon slices, I have my soy sauce, I have my, you know, so I know how to manage that. And I make sure I have enough fiber in my diet so I don't let it sit. I kind of evacuate. I want to make sure I evacuate on a regular basis so that nothing just sits there.
Yes,
So,
because you have the knowledge to do this.
yes. And I'm also testing my bifidobacteria, so it helps.
So that's why I want to get into the bifidobacteria. So let's go with well, I'm going to talk about long COVID and together long COVID and the COVID vaccines and how they affect both of them affect the bifidobacterium and why some people can have the
So,
vaccines and not have problems, but then other people have the horrible injuries, and then some people get COVID. They can even get a bad case of COVID, but they don't get the long COVID. Somebody can have a very light case of COVID, and then next they've got long COVID. So
yeah, so COVID is interesting because COVID, you know, can occur because creates or is associated with loss of bifidobacteria for three different ways, okay? So one is you started off with loss of bifidobacteria to begin with, you know, you're a high, intense person, stressed, drinking a lot of alcohol, eating the wrong foods, and basically you killed off your bifidobacteria. And then from there, the virus penetrated, right? The second way is basically the virus penetrated and killed off your bifidobacteria, a process we call bacteriophage or bifidophage. Bifidophage is essentially the killing of a bacteria, a bifidobacteria specifically, with a virus. So viruses have the potential of killing bacteria.
but let's wait. I think before we go on with this, I think we have to talk about the importance of the bifidobacteria.
Bacteria we discovered during COVID was an important bacteria that helps protect against COVID. So we believed anyways. So what we did is we essentially looked at patients that had severe COVID versus people that were exposed to COVID but never got COVID. And what we discovered was the people that were exposed to COVID but never got COVID had a lot of bifidobacteria, but the people that that had COVID and were severely sick from COVID had zero bifidobacteria. So that started the idea of maybe bifidobacteria is important to protect oneself from COVID. Um, my whole experience on the pandemic, and I'm going to be publishing my own case, was really the realization of the importance of bifidobacteria. So bifidobacteria is a bacteria that occurs in newborn, disappears as we age. It is lost in autism. It is lost in Alzheimer's. It is lost in invasive cancer. And therefore, one wonders, does autism occur because of loss of this good microbe? Does Alzheimer's occur because of this loss of good microbe? Does cancer occur because of this lost microbe? Possibly. Of course, there needs to be more validation on this research, but it's still a good enough research to kind of say, yeah, maybe it starts with loss of bifidobacteria. Here's the thing about bifidobacteria, it's not that straightforward. It's a very easy microbe to kill, and it can be killed with a virus like COVID. It can be killed with other viruses. It can also be killed by antibiotics and the treatment for the virus or the bacteria. So it's very difficult to retain bifidobacteria in a world that is full of toxins, and in a world where they're spraying our vegetables, and in a world where even vegetables themselves have a lot of viruses, not necessarily pesticides, but viruses that could in themselves create a bifidophage. So
And the bifidobacteria is, I've read somewhere that it's like a master regulator. It helps other
well, that's what they
bacteria.
like to believe. I don't think it's a master regulator. I think there's other microbes that are a little bit better than bifidobacteria. But for the purpose of civilization right now and where we are in the science of the microbiome, we're gonna stick to the bifidobacteria. But I personally think there's better than bifidobacteria out there to create a resilience, but we're
Really?
not there yet. Right now, we're trying to showcase the bifidobacteria. It's like the alphabet, you start with the letter A. So we're starting with bacteria, the letter B, bifidobacteria, and then we'll go on to other microbes. And also realizing that it's not necessarily just about the one microbe, it's a microbe in the environment of other microbes. I like to look at the microbiome like a community. So you can have a community that gets along and everybody's doing everything to work together, kind of like, those retreats where people live and commute together, and there's teachers and there's farmers and there's the accountant and everybody kind of works together to create that community. So I think, to me, so that's a good community that all works together. But then every so often you have a bad player that tries to control the community and basically tries to take over the environment, right? And creates chaos. So to me, that's how I look at the microbiome. It's essentially a community of microbes that either all get along and keep the balance and keep the human healthy, or there's a disruptor in there that entered and starts creating chaos in that gut, which then starts going up and down the brain and creates confusion and foggy brain and messes up with the human being, which then, by the way, creates chaos in the community of you.
Right.
And then you've
The
got,
cycle.
you extrapolate that one human that poisons everybody's mind, and then that human and its community starts creating chaos in the bigger planet, right? So I think it starts, sadly, probably as a dysbiosis of the microbiome, that dysbiosis of a human, that creates a dysbiosis of a community, that creates a dysbiosis of a culture, and that creates a dysbiosis of the planet.
Yeah.
And
I think we're probably going to find that's absolutely right.
yeah.
And so do you think that if we lived, well, let's just take a country where they're not spraying and they don't have all the pesticides and they eat, lots of plants, lots of healthy foods, and they have, healthier communities, do those people have more bifidobacterium
I
when they're
don't think,
older, as they
I
get
don't,
older?
I don't think so. And I'll tell you, and I know you've seen my diet.
Yes,
I tend to remove greens from patients, right?
yes,
And I remove blueberries and raspberries and strawberries because they're all kind of on the land, but it's more than the pesticides. It's also the amount of microbes that those vegetables accumulate. If you look at a piece of lettuce, it's got a ton of microbes. And I think when you're trying to grow back your microbiome, the
yes.
last thing you want to do is just suffocate it with a food that has a ton of microbes.
But what about when you cook the food?
Well, that's a different story, but I'm talking about like salads and
Okay.
lettuce. Yeah,
Yeah,
but
I agree with
you're
you. I
cooking the
agree.
fruits, if you're washing them with vinegar water or salt water,
Yeah.
probably you're killing a lot of the stuff to get the benefits
Mhm.
of that vegetable or that fruit or that vegetable.
But in a
But
place,
again, are you giving and and I'm gonna say this, probably a lot of people are not gonna like this, but are you giving a person that should be a carnivore, are you giving him a plant-based diet? And is that more detrimental than anything? In other words, the person was from generations and generations of eating meat and
yes,
being carnivore, and now you're switching their diet drastically
like
to
an Inuit or something, like taking an Inuit and putting them on a plant-based diet, they probably
yes,
couldn't, they would,
yeah,
well, they certainly,
tolerate.
it'd have to be a very, very long transition if they could ever
And, and,
transition.
and, and the question then becomes, why would I transition? Shouldn't I just keep them on a carnivore
Well,
diet?
I mean, they don't live that long. They live, into their 40s, where, so let's say they wanted to live longer, then you might try that.
There's no data that a carnivore versus plant-based lives longer
But
either.
we don't know because we haven't, the only ones we've
We
studied
haven't
are
studied it, yeah.
the Maasais and the Inuits, and they have fairly short lifespans, but it could also be where they live. It could, there could be other things at play. But so we don't have any like
Plant-based also.
Westerners. We don't have any
Yeah,
Westerners who've done it long enough yet.
I think if you ask me, I think it's a question of resilience, and do you build up the resilience to become a plant eater? But, there are certain things that you need from beef, like if I look at bovine immunoglobulins, which I give my patients,
Right.
that increases the bifidobacteria, that decreases the proteobacteria, that increases the firmicutes. So it's got a good basis, when you look at,
Right.
that's the blood from the cow spun around.
Yes.
There are proteins and there are definitely compounds in the beef that, create an environment of health for certain humans as well. So I think I tend to, because you talk to certain physicians who are carnivore based and they train their patients to be carnivore diet, and their patients do better, on the carnivore diet than they do on the plant-based. I think at the end of the day, it's trial and error, and it just shows how different we are as human beings, that we do not require the same diet. And I embrace, and respect both diets. I respect the person that's
How's the
plant-based.
carnivore diet? How is it for bifidobacterium, the carnivore diet?
Showing that data, so I'm not gonna talk about that. Same with the
Don't
herbivores.
have
So
that
we
yet.
have that diet, we have the differences in the diets, herbivore, carnivore, vegan. So
I'd
we
sure look forward to
showcase
seeing that.
what it increases, what it decreases. Nothing that I can talk about right now.
Is my stool in that one?
I think you are,
Yeah, because
yeah,
I'm in the vegan plant-based
yeah,
one,
yeah,
but
you're, If
I
you're in
became,
the vegan, ginger already has you in a category, don't worry.
right, and I always had, and I had Biff, but I became,
And you were before, we have a baseline on you before.
yes, yes.
Yeah.
So, but anyway, some of the things that I want now, one of the things I want to go into. So you have worked with people. Have you had some success with helping people with long COVID and vaccine injuries?
Yeah, so I focus mainly, as you know, on the bifidobacteria.
Yes.
I focus on manipulating the microbes.
Yes.
So we're working with various products right now. We're testing different things to see. So obviously bovine was a great discovery because it
Yes.
includes
I
bifidobacteria.
take it. I do.
Yeah.
I take it. I'm vegan,
Yeah,
but I take
perfect.
the
Yeah,
bovine.
vitamin C, B, and zinc was a great discovery.
Yes.
It increases the bifidobacteria and the firmicutes. So those were basically, that's, the vitamin C, D, and zinc. I can kind of like say, yes, I'm sure I've seen it over and over again. Where it gets muddy and gray zone a little bit is introducing probiotics. And you would think that when you use bifidobacteria for a person that has zero bifidobacteria, that it would restore their microbiome. But here's the problem. It doesn't in all. There's a small percentage
Really?
they do improve with the probiotics. And there's a small percentage that it actually kills their own bifidobacteria that they started off with, almost because it's a competitive.
But do you know if that's happening to me?
Well, we're gonna be looking at all that data soon. But we're basically looking at people that started probiotics that had bifidobacteria and then dropped their bifidobacteria after the probiotics. Because that's data, right? That's telling us something's going off. Maybe the body is rejecting that bifidobacteria that I'm giving it, right?
Mm-hmm.
So
Yes.
probiotics in themselves, they're controversial to me. I've given it to patients that have zero bifidobacteria. I do not give it anymore to patients that have bifidobacteria because I feel that those people could benefit with a good vitamin C, D, and zinc, like I put you on, or bovine immunoglobulins, like I put you on. So, and that alone is enough to just improve the bifidobacteria without having to do anything else.
Okay. You still have me on probiotics. So
Yeah, and you're feeling better, so, I kept you
yes,
on.
they make a difference, but
But
they
the
def
truth,
it
the
has
truth is
what
gonna
it's
happen.
done is it's changed my microbiome. So a lot of symptoms are much better, but now some symptoms are worse.
Well, and that's what I'm talking about, right? So and this is where retesting to see if it's increasing your
Yeah, I'm
bifidobacteria.
going to do that. I'm going to do that like
If
in
it
next
doesn't
week.
increase your bifidobacteria, then there's no point in that. Then maybe
Exactly.
what you're seeing is improving is really the vitamin C, D, and zinc and the bovine, but then we're doing detriment by giving
I
you the probiotics.
well,
And
what
let me tell you, and you know how selective I am of
yes,
probiotics,
yes, I know.
I work with the lady who basically started the whole probiotics in America. But, I have to say, I have to look at the data the way that it is, right? I mean, at the end of the day, I have to be objective and call a spade a spade. If a patient is not improving, so for example, there's a new product. If a patient is not improving on a probiotics and is actually getting worse, then, and the only thing I changed was adding this probiotics, then I'm gonna say, well, no, you know what, the probiotics could have done. I had this situation recently where I did a fecal transplant on a gentleman who basically was highly influential, travels all over the place, is very, very stressed, and basically, he tends to kill his bifidobacteria because he's high, you know, high output. He's all over the place, he's exposed to so many people all day long. And so he's exposed to viruses. And, no matter how good your gut is, at some point, you're going to get hit with a virus because it's just over flooded, right? You're just over
No.
flooded with viruses. So anyways, so in this gentleman, I did a fecal transplant because he had, C. diff, and he was so much better. And then he started getting a little bit worse, and his bifidobacteria started dropping. So I put him on a probiotic, thinking, well, you know what? It doesn't. And these are cases here and there. Literally within 2 days of being on the probiotic, he developed SIBO. He got gassy, bloated. So I have to pay attention to these cases, right? Now, granted, that doesn't mean I'm not going to give the probiotic or try it anymore. But here's the problem. I had given him a new microbiome, and I gave him probiotics that basically probably opened up in the small bowel and created SIBO. And now I'm dealing with a different set of problems, which is SIBO, which is, overgrowth of bacteria in the small bowel, which fecal transplant is not going to be helping most likely. And now I'm going to have to put this guy on what we know best of antibiotic for SIBO, which, my friend Mark Pimentel has done these studies. So, how many cases have I seen where the probiotic actually made the case of SIBO worse? So we have to pay attention, right? So, and we have to realize this is a beginning of research on the microbiome. And these tests are expensive before and after, you've spent them.
Yes. Yeah.
So, and I have you on a new product now to see if it's improving. So, when we change protocols, we have to relook at the microbiome, what is changing, right? I'm doing a study right now on Ion, which is a product of Zach Bush.
Yes, I know
And
his product.
and he's seen amazing results in cancer patients. He's seen amazing results in autism. I want to see if it does anything to the microbiome. So we have to test it.
I'm glad you're testing that. Wow, I'm really glad.
He's a great physician. He's very ethical, righteous. We have the same vision of the microbiome and the planet and nature and
Yes,
preserving.
yes.
And actually, believe it or not, I'm paying for the stool testing and I'm paying for the repeat of that because I see it. Because only in, the majority of repeats that I do on patients when I want to test a product, either the patients are generous and they're paying for it and they're like, Dr. Hazen, don't worry, I'll pay for it because they know, I don't have a ton of money. We're sponsored by the Microbiome Research Foundation. We get to pay for these tests, but it's a hassle to get people to donate, so I'm constantly fixing people and then I beg them to donate to the
I
foundation.
know you're having to do so many different things.
So, and then, these vitamins that I created that you're on
Yes.
are to support, every penny of that goes to the foundation to support the research. But, here's a doctor who basically said to me, Sabine, I've seen improvement. I mean, he's not lying. Why would he put himself through all that for a $50 product? You know what I mean? Unless he saw something. It's like me. Why would I talk about feces if I didn't see something? And all of us, ivermectin became the most popular drug because doctors saw something and started speaking, and they were outraged that they couldn't give it, right? How could you tell me, how can you tell me that I can't give a drug that we gave to babies with scabies and I can't give it to a patient that's dying of COVID, right? So that's where you go, whoa, I gotta speak out, I gotta speak up, I gotta be courageous, I gotta fight this is war. So anyways, I talked to him. We have a couple of kids with on the spectrum that we're giving it to them. We're giving it to the complex patients. We want to see. So what are we doing? We're basically giving the product, we're giving a baseline, and then we're changing nothing in the baseline. And then we're giving the product and retesting the stools after. So we'll see.
That's great. Well, one of the things now I want to go
Also
into
doing lactoferrin. We're also doing Manuka honey. So anybody that wants to volunteer for our studies, anybody that wants to volunteer for our studies, I would say contact Ginger at progenabiome.com. put yourself on a list and we'll call you from the list.
And you're not are you practicing gastroenterology anymore at all? Or are you just doing this?
I'm still practicing GI.
So somebody could see you as a GI doctor.
I don't take insurance anymore.
Well,
Sorry, I got a choke on my throat. I don't take insurance because in that 10 minutes that the insurance gives me with the patient, there's no way I can take a full history of the patient. And I also have 13 employees to do what I do. So there's no way insurance is going to pay my 13 employees and my overhead and everything. So unfortunately, everything I do is on a cash basis because this is research. And it's research where basically the patient becomes his own detective with me to try to figure out what works, what doesn't work, and looking at the microbiome, they use our lab to see, and we also help them with what we know of the microbiome and what we've seen, like we're going to get data on ion, we're going to get data on lactoferrin, we're going to get, here's the thing, right? Maybe some things work for a certain signature microbiome, right? And maybe, so like bovine immunoglobulins, for example, if you have low bifidobacteria, high Bacteroides, low Firmicutes, high Proteobacteria, low diversity, bovine's amazing for you. Because what we showed in our data is that the people that have that formula, it flips it. So maybe it's the formula. Now, what if, how you hear, I remember Judy
Mikovits.
Mikovich. Yeah, so Judy basically talks about suramin and autism, right?
Yes,
she believes in suramin. She probably saw some patients that improved with suramin their autism. Here's the thing, did suramin improve some patients with a certain signature microbiome? And therefore, there was luck, right? That you gave the drug at the right person with the right signature, right? Here, I'm doing something else with my kids with autism. And some kids I do fecal transplants, some kids I manipulate the microbiome, and somehow I'm able to reach improvement. But at the same time, it really takes that due diligence to understand the microbiome to precisely find the formula that that kid needs. In the future, that's what it's going to be. It's going to be you're missing these microbes, you have these microbes overgrown, you need this to blast the microbiome, and you need this to boost the microbiome. It's going to be a biome blasting and biome boosting.
And then it can be later, it can be, okay, now we got to back off from this, and now we need to do this. And so that's one of the things I want to say about you is there's so many people out there that are, going online and doing stuff online, and they're just throwing stuff at their situation. They don't really know what's causing it, exactly what's causing it.
And they're just complicating things.
I know it. So when you work with Dr. Hazan in her clinical trials, or if you're able to go out there and have her be your GI doctor, you're having somebody, this is all still experimental because this is new science, but at least what she's doing is she's able to look at your microbiome as and see the things that there's so much more that we don't know, but she can see the things that we do know, and she can look at this, and she's seen so many different samples, and you can see the different illnesses that are in common with this.
And we definitely see signals, like we see signals with Parkinson's, we see signals with Alzheimer's. We definitely see signals, and we also see signals in the treatment. So, but you have to also realize there's so much we don't know. For example, the pandemic was a great learning for me because I got to see what doxycycline does on the microbiome. I got to see what ivermectin does on the microbiome. I got to see what hydroxychloroquine does on the microbiome. Here's the best example of hydroxychloroquine. Hydroxychloroquine Z-Pak, we discovered, killed the virus, okay? So it was initially my patent because I said, well, if I'm embarking in this, I want to have the credit that I figured out that it kills the virus in the stools. And so I created a patent with vitamin C, D, and zinc. Vitamin C, D to increase the bifidobacteria, and zinc to increase the lactobacillus. So basically, in my mind, that's how I was fixing COVID, was increasing the microbiome, killing the virus, right? So that
Yes.
was my patent. The only thing that I discovered with my patent is that it wasn't for everyone. It was for the elderly that were decompensating quickly, because the problem is, if you give hydroxy Z-Pack to a young person, you're also killing their microbiome. They didn't need that strong of a gun to kill the virus. They probably just needed vitamin C or vitamin D, or even ivermectin or doxycycline. So it was really a learning experience on the front line to see, who do I give this drug to? You know, drugs like remdesivir were not even an option, because let me tell you, it was so difficult to get a nurse to go to the house and give an IV injection to patient, IV infusion of patients. So remdesivir was not an option. Regeneron was an option. We did find some people that were, interested in Regeneron. But, on the most part, those patients that didn't want to go to the hospital, I was stuck treating them with the drugs that were just simple pills to take. And so what are my simple pills? Ivermectin, doxycycline, azithromycin, hydroxychloroquine, vitamin C, vitamin D, zinc. That was my repertoire, right? It was kind of like a recipe, right? So I saw the patient, I took the history, I assessed the severity of the patient. The patient was severely COVID and severely hypoxic. I would hit it fast with hydroxy Z-Pack to kill the virus. And I would give it ivermectin, ivermectin, vitamin C, D, and zinc to increase the microbiome fast. And so that was my rationale, but I learned that on the front line because I experienced, what it was to succeed in the treatment. Doing that, I also saw the microbiome. I saw that hydroxychloroquine killed the bifidobacteria. I saw that azithromycin killed the microbiome. I saw that ivermectin increased the bifido within 24 hours, but it didn't sustain it. So all this was learned by really, this is what I was saying about understand the microbiome by being courageous enough to try different drugs.
I don't know. Is there anybody else who knows all of this?
Probably not, because
I wouldn't think so. So just some of the things that you're testing right now, just so people know what you will have some published studies at some point on. I know that you're doing autism. What about mental and emotional health?
we have a study on anxiety and bipolar disorder and schizophrenia. We already published on anxiety and bipolar disorder. There's a signature microbiome there.
And they can, well, let's give, because I want to start giving some solutions. They can go to your Progenabiome website.
They can go to Progenabiome website and they can register and contact Ginger or Progenabiome if they have a condition that they want to be part of a clinical trial. And essentially, when we have funding for that condition, we essentially call them. When we have funding to test a product, like we want to test Manuka honey, for example, we will call people with, a certain condition that we're testing Manuka honey for, or lactoferrin or etc. So right now we're basically testing just healthy volunteers. So anybody that's healthy that wants to put their names on our list, go for it. Contact Ginger at progenabiome.com. If you have a disease, autism, Parkinson's, those are the two that I'm studying right now, trying to manipulate the microbiome. So you're welcome to contact us. You can join the clinical trial and be a patient in essence, but you'd have to pay for time, etc., because nobody's sponsoring these clinical trials, unfortunately. But if you don't have funding to see me or to do testing, please put your name on the list with Ginger at progenabiome.com so she can then call you when we have funding. So we are ever so often we have billionaires that want to put in money into the Microbiome Research Foundation, and they'll put in like 300,000 or $500,000 as a donation, and then we can get to look at Parkinson's. So we were lucky that we had a huge donor, not huge, but enough to kind of do at least 40 samples of Parkinson's patients. So we got to see what Parkinson's looks like. From there, we got to write a protocol that is at the FDA right now. You know, unfortunately, even these protocols that you submit for familial fecal transplant are expensive to put through the FDA. It's in the hundreds of thousands of dollars. So we need donations for that to help us.
Okay, we need to explain quickly what the familial fecal transplant is.
Fecal transplant is basically you have a condition like Parkinson's or Alzheimer's, and you want to see if your kid, grandkid, or even spouse can be a donor for you. Familial is not spouse, but essentially kid or grandkid or sibling. That is normal, so neurotypical. So if I'm looking at Parkinson's, for example, I would be looking at a neurotypical person. And that's it. That's what I would do. So, and then I would say if that microbiome is what that person is missing, and then that person would donate their stools for their family member. So familial fecal transplant for autism is essentially taking the microbiome of a sister and giving it to her brother with autism.
And so,
If
and
she
why
has a good
why do you do that as opposed to just getting the fecal matter from a bank, a fecal matter bank?
From a bank, but the bank, you have regulations and it's not approved for autism or Parkinson's right now. And I don't know, I tend to believe that familial might be better. But
Okay.
that's just
It
my
makes, makes
hypothesis as a
sense. It
scientist.
makes sense. I just want to,
I'll tell you why, because you're in, you know, stools is not just feces, it's also DNA. It's also, we actually wrote a paper and did an abstract where we found human DNA in stools. Because you have to think about it, there's red blood cells, there's white blood
Right.
cells in stools, there's shedding of colonocytes.
Yes,
So
yes.
when you are giving stools from one donor to another, you are giving that human DNA as well. So,
with,
and with the human DNA are stem cells in there, right? So are you passing stem cells? So all that is very important.
oh, I would think people would probably tolerate it even better from a family member.
Maybe, I think personally, as if I had a disease, I would probably want my grandchild or my child's poop rather than a stranger. I have no idea who he is or if he's suicidal. You have to remember a lot of these stool banks are paying a lot of money to patients to donate stools, right? So, you know, are they saying the truth on their questionnaires that they don't use drugs, that they don't use alcohol? You know, I mean, a lot of these kids are from, you know, colleges, and you know, $500 is a lot of money to get paid to give your shit, right?
Right.
So, you know, what can I say? But I'm gonna have to wrap it up because I have a patient.
Okay, well, the last thing I want you to, so I want them to know about the Progenabiome website that
Yes,
they can go, you've got quite a few published trials
yes.
already. They can read about the results. And so they now know how to get in touch
And
with.
podcasts, there's a lot of podcasts, your podcast will
Yes,
be on there.
yes,
So,
yes.
and my testimonial from the Congress and, you know, shows with Jillian Michaels and Ma, etc. So there's a lot of every podcast, I think I leak
Wonderful.
information. Because unfortunately I do want the science to go and move. So that's why I leak it before I publish it. So there's a lot of pearls in there of what I've learned over the years doing this and what I learned from COVID and how to survive, you know, a virus. And also we're gonna see all these products. What is ion doing to the microbiome? What is
Yeah,
lactoferrin? What is manuka? What is curcumin? You know, so many things.
yes, you're so wonderful what you're doing. You're really a true
You know,
hero, Jason.
we need to look at that. We cannot advance science and the idea that people say, well, research is expensive. No, it's not that expensive to test the microbiome before and after, especially when we have a database. We have huge databases of Parkinson's, Alzheimer's, autism. So if we had a good research, then I could tap into that research. If we figured out a product like an herb that improves the microbiome, then it could go through the FDA, do the right thing, do the right pathway to bring that herb to the condition so everybody's happy and we bring a product out of it and it doesn't have to cost millions. It could be $600, $700. I think we've overdone it with pharma. These biologics that are costing $10,000 a month, it's too much.
Oh.
These kids that are on biologics for the rest of their lives, remembering that they have Crohn's, it's too much. We need to start reaching cures. Enough is enough. And it starts with understanding, what does anything do to the microbiome? One glass of wine improves the microbiome, but maybe 4 glasses kills it. There's so much to be done. This is a new frontier. And I want everybody to embark on it. Those that have money, please support us.
Yes.
Because I'm also working with a company now that's actually a stem product from plants. What is that going to do to the microbiome? There's so much to learn. And here's the other thing. I don't think it's necessarily just one way. I think it could be one way for this person, one way for.
I agree.
And ultimately, there's a lot of money and there's a business to be made by everybody. It doesn't need to be one business for all. I think somebody told me to start a business, all you need is like a couple thousand customers. So, just start a business. You don't need to be the billionaire that owns all the pharmaceutical products. You just need to have one product that works for this population, and that's it.
You're a hero and a pioneer, and I thank you so much for all the work you're
Thank
doing.
you.
Thank you for taking this time to
Same
answer these
here.
questions and explain things.
All right. Thank you. Till next time.